Hi, hello, welcome back. So today we'll be seeing about Phrenic nerve stimulation system. The code series for this is 33276 to 33288. So we have added a list of CPT procedures under the playlist CPT coding. Please go through it. So for definition is phrenic nerve stimulation involves the use of an implanted device to electrically stimulate the phrenic nerve which control the diaphragm muscle. This procedure is typically used for patients who suffer from chronic respiratory failure due to condition like spinal cord injuries, central sleep apnea, etc. So we have CPT code range 33276, 33277 and 33278. So it is the insertion or replacement of permanent subcutaneous implantable lead or subcutaneous implantable pulse generator and all. And 33279, 280, 33281. These are removal and replacement code. So read each code properly so that you can clearly understand what is the purpose of that code. And 33282, 33283, 33284. So here revision or removal and repositioning is given, insertion or replacement is given. So read that definition clearly, description clearly. Example 1. Case of diaphragm paralysis, a patient 45-year-old male with diaphragm paralysis due to spinal cord injury. So here the procedure is patient undergoes insertion of transvenous phrenic nerve stimulation electrode. So we are giving 33277. Example 2. Revision surgery. A 60-year-old female with an existing phrenic nerve stimulation system experiencing malfunction. Procedure is repositioning of transvenous electrode and replacement of pulse generator. We are giving 33283. Conclusion. Phrenic nerve stimulation is a crucial intervention for patients with chronic respiratory failure due to neuromuscular disorders. Accurate coding of these procedure is essential for proper documentation and reimbursement. Tips. First, we have to understand the device component like phrenic nerve stimulation system including electrodes and pulse generator. Detailed documentation like what is the procedure, whether it is an insertion, revision or repositioning or removal. Stay updated with the guidelines. That's all about this topic. Thank you so much for watching. If you have any doubts, you can put it as a comment. And if you haven't subscribed my channel, please do subscribe and share it with your friends also. Stay tuned so that you will get further updates of other guidelines also. So thank you so much for your time. Take care. Bye bye.